water resources in Kerala, it can be considered as one of the boons, and also there is a grim side to it. With around 44 rivers flowing through it, it's one of the most water abundant states in the country, but on the other side, there is a grim situation to it. Some of the studies indicate that most of the water bodies in the state are affected and infected by the fecal coliform bacteria. The situation is more grim considering the fact that not only these natural water resources are infected, but also the very basic drinking water for the people is also affected by the fecal coliform. Going by some statistics, it is believed that out of the maximum sewage which is generated in the country, in the state, only 2% is actually treated in an effective manner in the treatment plants. And the remaining is illegally dumped into the river's resources, not only polluting these beautiful resources, but also, on the other hand, creating a lot of human impact in terms of disease illnesses. Thus, the requirement for liquid waste management is well seen. This was also depicted by our Honorable Chief Minister in his today's speech during the Expo. Considering the fact that liquid waste management is the situation, is the need of the hour, we are here for this liquid waste management track. To discuss and to initiate, I would like to now invite the chair, Shri Arun K. Vijayan sir, to, yeah. A brief introduction about sir. He is an IAS officer from 2016 batch, Kerala cadre. Sir is presently the Director of Urban Affairs and Amrut, Kerala. He was also a District Development Commissioner for Thrissur, and he has a rich experience as a Chief Operating Officer in technology and service industry. I welcome you, sir, for this session. Next, we'll have for this panel discussion on urban solid liquid waste management in the context of Kerala. I would now like to invite Ms. Sujaya Rathi to the stage. A brief introduction about ma'am. Ms. Sujaya is a member of NFSSM Alliance. She and her team has been working extensively in the field of sanitation and urban infrastructure. She has developed the renowned FSM toolbox, and this has been utilized by various countries for planning in sanitation. So I welcome you, ma'am, for this panel. Thank you. Moving ahead, now I would like to invite my panelists. Very first, I would like to invite Mr. Santosh. Mr. Santosh, can you please come on stage? A brief introduction about Sir. Sir is the team lead for Tamil Nadu Urban Sanitation Support Program. He advises the government of Tamil Nadu on various liquid waste management strategies and issues. So I welcome you, sir, for this panel. Thank you so much. Moving ahead, now I would like to invite Mr. Rajiv Raman. Sir, can you please come on stage? Can we have continuous clappings for the panelists, please? Thank you. Thank you so much, sir. An introduction about Sir. Sir is a consultant for WASH. He has been extensively worked with the World Bank and has advised on urban sanitation projects. Sir has a very deep understanding of the various challenges and the context in terms of the Kerala's context. So I welcome you, sir, for this panel discussion. Thank you. Moving ahead, I would now like to invite Dr. Uday Bonde to come up on stage. Sir. Dr. Uday is a senior program specialist at NIUA. He and his team at the Water and Environment Vertical at NIUA have been advising for the Clean Ganga Mission, which is NMCG, on making the rivers clean, healthy, and lively. So thank you so much, sir, for your time for this session. Next, I would like to invite Mr. Sunil Agarwal to come on stage. A brief introduction about Sir. Mr. Sunil is the director for Toilet Bowl Coalition. He and his team has been helping the entrepreneurs in India as well as in Global South on various sanitation business models. So thank you so much, sir, for your time here. Last but not the least, I would now like to invite Ms. Anandita Mukherjee for this panel discussion. Ma'am. Ms. Anandita is a researcher at Center for Policy and Research. She, with her team, have been extensively working with the government of Odisha on the various liquid waste management strategies and supporting them with policy and implementation. So now we will start with our panel discussion on urban sanitation models in context of Kerala. For this, I would now like to invite our moderator for this discussion, Ms. Sujaya.
Good afternoon, everyone. A very warm welcome to each of you. Dr. Akanksha has set the context why we are here today to discuss this critical issue for Kerala. We are discussing this today because it is critical and it is urgent. It is critical for three reasons. One, it's a public health issue where we saw in the 2018 floods, fecal coliform was all over. And when there is climate change, in the context of climate change, this becomes a very, very important and a critical issue for public health. Number two is also it's God's own country with an abundance of rivers and lakes, 40,000 identified water bodies. This was mentioned by Akanksha. One very important aspect of is tourism for Kerala. The economy has a huge impact on the type of water, the quality of water that we have. If all the riverine state is polluted, it affects its economy, its livelihoods. Even the fishing exports can be affected. So there is a livelihood aspect to it. So we are in this critical junction where we are trying to address the inadequacy of liquid waste management. One is the impact on climate change, number two on economy, and number three on public health. So we have an esteemed panel today, and we will start with Mr. Rajiv Raman, who has done extensive work in Kerala to set the context and the challenges that is faced for liquid waste management in the state. Over to you, Rajiv.
Good afternoon, everybody, and thanks for the introduction by Akanksha and the tone set by Sujaya. കുഴപ്പമില്ലെങ്കിൽ ഞാൻ ഇംഗ്ലീഷും മലയാളവും കലർത്തിയിട്ട് സംസാരിക്കാം. എൻ്റെ ബേസിക്കായിട്ട് ഈ ടോപ്പിക്കിനെ പറ്റിയുള്ള ഒബ്സർവേഷൻസ് 2019-ലും 20-ലും കേരളത്തിലെ പല മുനിസിപ്പാലിറ്റിയിലും പോയി വിസിറ്റ് ചെയ്ത് മുനിസിപ്പാലിറ്റിയിലെ ആൾക്കാരോട് സംസാരിച്ചതിൻ്റെ ബേസിസിലാണ്. So if I go back to what was referred by both Akanksha and Sujaya. Okay, sorry. About the large number of rivers, 41 flowing west and 3 flowing east in this state. ഒരു കാര്യം മനസ്സിലാക്കാനുള്ളത്, ഈ 44 നദികൾ പോകുന്നത് 560 കിലോമീറ്ററിൻ്റെ ഒരു നോർത്ത് സൗത്ത് ലെങ്ത് കൂടെയാണ്. അപ്പം ശരാശരി നോക്കിയാൽ ഒരു 15 കിലോമീറ്റർ കൂടുമ്പം ഒരു നദി അല്ലെങ്കിൽ നദിയുടെ ഏതെങ്കിലും ഒരു ട്രിബ്യൂട്ടറി കാണേണ്ടതാണ്. പക്ഷേ നമുക്കറിയാം നമ്മുടെ സ്റ്റേറ്റിൽ ഇറ്റ്സ് കോൺസെൻട്രേറ്റഡ് ഇൻ സർട്ടൻ പാർട്സ്. എസ്പെഷ്യലി തൃശ്ശൂർ തൊട്ട് കൊല്ലം വരെയുള്ള ബെൽറ്റിലാണ് കൂടുതൽ വെള്ളത്തിൻ്റെ ഫ്ലോ കാണുന്നത്. നമ്മുടെ റിവറിൻ്റെ സൈസും ഇസ് ഡിഫറെൻറ്റ് അക്രോസ് ദ സ്റ്റേറ്റ്. So while we might have an abundance of water, the counter to that is that most of this water reaches the sea very fast. അപ്പം നമ്മുടെ പൊല്യൂഷൻ കൺട്രോൾ ബോർഡിൻ്റെ അല്ലെങ്കിൽ സ്റ്റേറ്റ് എൻവറോൺമെൻറ്റിൻ്റെ റിപ്പോർട്ട് എടുത്ത് നോക്കിയാൽ 40% വെള്ളം 4 മണിക്കൂർ അല്ലെങ്കിൽ 6 മണിക്കൂറിനുള്ളിൽ കടലിലേക്ക് എത്തുന്നു, നമ്മുടെ സംസ്ഥാനത്തിൽ നിൽക്കുന്നില്ല എന്നുള്ളത് വെള്ളത്തിൻ്റെ കാര്യം നോക്കിയാൽ ഒരു പ്രശ്നമായിട്ട് നമുക്ക് പറയാം. ബട്ട് അറ്റ് ദ സെയിം ടൈം ആ വെള്ളം ഫ്ലോ ചെയ്ത് പോകുന്നുണ്ട്. വൺ, ഇറ്റ് ഈസ് ഫ്ലഷിംഗ് വാട്ട് എവർ is the area that it is flowing through. Second, it also creates problems if we don't manage it properly. Along with this, there is a situation where at least 15 to 20% of urban Kerala, in Nagaram, in this town of Cochin, there are a lot of parts in Cochin which are actually at sea level or below sea level. അപ്പം താഴ്ന്ന പ്രദേശങ്ങളുണ്ട്. ഇവിടെയൊക്കെ ഗ്രൗണ്ട് വാട്ടർ 5 മീറ്ററിനുള്ളിൽ വെള്ളം ഗ്രൗണ്ടിൽ കിട്ടാവുന്നതാണ്. ഈ സ്ഥലങ്ങളിൽ നമ്മൾ സാനിറ്റേഷൻ കേരളത്തിൽ നോക്കിയാൽ ഒരുമാതിരി മിക്കവാറും ഓൺസൈറ്റ് ആയിട്ടുള്ള സാനിറ്റേഷനാണ് യൂസ് ചെയ്തിട്ടുള്ളത്. സെപ്റ്റിക് ടാങ്ക് ആണെങ്കിലും ലീച്ച് പിറ്റ് ആണെങ്കിലും. സുവറേജ് പൈപ്പ് ലൈൻ വെച്ചുള്ള സൊല്യൂഷൻ നമുക്ക് തിരുവനന്തപുരത്തുണ്ട്, കൊച്ചിയിൽ കുറച്ചൊരു ഭാഗത്തുണ്ട്. ബാക്കി അക്രോസ് ദ സ്റ്റേറ്റ് sewerage solutions are very minimal. So when you look at that, most of the human waste is actually going into the ground, and especially in this 15 to 20% population areas where your groundwater is very shallow, this waste actually doesn't get treated well. It starts flowing subsurface. It can go into your well if it is nearby or into other water bodies. So that is possibly one of the reasons why fecal contamination has been registered. There has been a study which got carried out by CWRDM Kozhikode. Right from 2009 up to 2017, in stages they had collected data in all the river basins of the state, which pointed to fecal contamination at all these points, and also in the wells where they had collected samples. So this is an issue which has been there with us, which in terms of our priorities we are waking up to. And like I think Sujaya mentioned, in 2018 when the floods happened, that was when we saw all this waste actually coming out into the open and floating. And that is when it registered that all these are things which are posing a risk to our public health. In terms of solutions, I mean, I went across the stalls. So you have a stall from Vadagara, Cherthala and all that. So there are municipalities doing positive things. But in terms of the aggregate, in terms of the total waste generated, we still treat only a small volume of that. And if you look at media reports and if you talk to people, one of the problems that we face is in siting a treatment plant or getting a proper site. When we get a site, there is immediately either a protest or litigation or some other situation which blocks work happening on that site. So there are certain projects which have stopped because of that, and it is not something new. I mean, we have been hearing of this from around 2013, 2012 onwards. There was an earlier ADB assisted project. It happened in the towns during that period also, Calicut, Trichur, and then later Cochin. That trend is seeming to continue. We are hoping that with an expo like this and the work which gets carried out with the local bodies, that the, attitudes also will change, because unless we have a treatment site, the possibilities of a solution for human waste and for other waste which come into the liquid stream, that is not a possibility. I come from Palghat, so we are a border district. So whenever a septic tank is emptied in my panchayat, it is taken from there right across Walayar. You cross the state, then you have coconut gardens and other places where that waste can be taken, even if the treatment plant is not nearby. But in our state, whether I go to Batteri, whether I go to Manandwadi, whether I go to Palaghat and discuss it, the point is all this happens clandestinely. Because we do not, in Palghat, there is no space for my septic tank operator to actually go and empty it. So he will come in the night, he will empty the septic tank in the night and take it. And that has been the situation in Kerala for a long time. 2013 was when a particular judge in the High Court of Cochin went for a walk early in the morning, discovered a septic tank lorry emptying septage to the backwaters. He came back to the court in the evening and filed a PIL, which asked the state government actually to start planning, taking action. So we are almost a decade from there. We still have problems of not in my backyard. I do not want a waste treatment plant near my house. So those things are still something which we haven't possibly learned how to change. I'm hoping that we can change that over the course, or start thinking about that over the course of this 3 days. Just one more thing I would like to add is that when you travel to the cities, that is, ഏത് തദ്ദേശ സ്വയംഭരണ സ്ഥാപനത്തിൽ പോയാലും, you will have places which are lowland. ചതുപ്പ് നിലം ഉണ്ടാവും, വെള്ളം കെട്ടി നിൽക്കുന്ന നിലം ഉണ്ടാവും, കൂടാതെ ചെറിയ കുന്നുകളും ഉണ്ടാവും. അപ്പം ഒരു സൊല്യൂഷൻ മൊത്തം ടൗണിനായിട്ട് എന്നുള്ളത് നമുക്ക് പ്രാവർത്തികമായിരിക്കില്ല ചിലപ്പോൾ. ചില ഏരിയാസ് ഉണ്ട് വിച്ച് വി നീഡ് ടു പ്രയോറിറ്റൈസ്. ആൻഡ് one thing which you see is the lower lying area, which is possibly land which has been distributed, land which has come up for residences later, are practically populated by the poorer, households. And that is where most of the waste of the town actually gets channeled to. Stormwater drain, baki drainage okke undaki kazhinja adodukam aa bhagathekana poova. But treating it, rendering it safe, and then making that area livable without any risk to public health, അതാണ് നമ്മുടെ എല്ലാവരുടെയും ഒരു കണക്കിന് ഒബ്ജക്റ്റീവ്. പക്ഷെ അവിടേക്ക് നീങ്ങാനുണ്ട്. I'll stop here.
Thank you, Rajiv. Anyone, Mr. Arun, if you want to add some of the challenges faced by the state?
I think Mr. Rajiv has very beautifully given a brief description of the entire problem which we are facing in Kerala. I would like to just supplement some few points which he has mentioned with some data points. So recently we had a campaign in which we were trying to figure out the contamination percentage of our water bodies. It was basically done by Shujitva Mission with the help of our self-help groups, Kudumbashree. We had the self-help group across Kerala go and test our water sources, public water sources, using mobile kits, small kits, which could give results. So surprisingly, or not so surprisingly, we realized like 83% of our water bodies, the water sources, are having fecal contamination. So that is the one statistic which in the last 1 year we have been trying to wrap our minds around, in the sense we have always prided Kerala as a clean state. In the sense we have achieved open defecation free status, ODF plus, much ahead of other states in India. But where this septic solution, the waste goes, that is something of a concern, which only very recently we have opened our eyes to. So as part of the NGT hearings which we are having, multiple states have been slapped with very hefty amounts of fine. Fortunately for Kerala, in the last December, I guess it was in November, we had a hearing in which we were given 6 months to get our act together. But some statistics which we provided at that stage was a total sewerage, the waste generated, the septic and sewerage waste generated in Kerala is around 1,192 MLD. Maybe a bit around 1,000 MLD. And what we tried to present to the NGT was that since we have open defecation free system across Kerala, all of our waste is getting captured and it is contained in the septic tanks. So we had represented that around 1,111 MLD of this, almost 90% of this waste is getting treated in our household distributed systems. And only the actual treatment facility which we have in Kerala is only 129 MLD. That is what Rajiv has already mentioned. In some parts of Kochi and some parts of Trivandrum, we have a networked sewerage facility. So that's where we treat our 129. That's around 10% of our waste in Kerala. Rest is contained in the household facilities. But this was not taken very lightly by NGT. They asked us to get a fix on this proper institutional treatment facilities ready for the entire state. So the gap of the remaining 1,111 MLD, we have to slowly build our institutional capacity for that. Right now, like I mentioned, there are around 19 STPs. The major one is in Trivandrum, which has around 100 MLD capacity, but the other STPs, the total capacity is 129. We have under construction around 11 STPs, which will add around 20 MLDs to the existing capacity, and proposed 59 plants as part of Amrit and Swachh Bharat, and some funds coming from Rebuild Kerala initiative, which we are using for construction of STPs in different municipalities and panchayats, which will add around 70 MLD to their existing capacity. So this is the problem. These are the figures which we are dealing with right now. There's a huge gap of actual institutional capacity which we require. And a few of the problems which we face while we try to set up institutional facilities has been already mentioned by Rajiv. First of all, like we have a severe land scarcity in Kerala. It's a very densely populated state, and most of our population lives either in very close proximity to the river banks or to the coastal area where the water table is pretty high. So getting a feasible land is one problem. Even if we get a feasible land, trying to build consensus of the people around, the public representatives, the stakeholders, is a very difficult task. So we have had situations where we got, for example, in city of Calicut, we had enough funds from Amrit. We had land available, which was directly under the custody of the local body. But still, across last 5 years, we have not been able to do much because of the public protest. So similar situations exist across Kerala, and as a result, we are definitely lagging behind the institutional capacity which we should have achieved at least 10-20 years before, given the advancement which we made in the other fields related to public health and sanitation. So hopefully this workshop and the contribution from the experts who have come over and the technologies which has been presented, that will be an eye-opener to the local body representatives. We have invited all the local bodies here, 10 representatives from each local body who will be visiting the stalls, and they'll be trying to appreciate the technologies which are available, and maybe they'll go back home with a better understanding of how liquid waste has to be treated in Kerala. So that is what I wanted to add, what Rajiv has mentioned in his opening remarks. Thank you.
Thank you, Mr. Arun and Rajiv. Anyone else need add anything to the challenges that Kerala faces? No. So if I may summarize, I think there are 3-4 major challenges that we see. One is, of course, the waste water that is generated is much greater than what is being treated. Different studies say different percentage, but however, the majority is not treated. We have 83 to 84% polluted water, and so that is a concern. So the challenge that is faced, I think Mr. Arun mentions, is about the institutional capacity. And also the solutions need to be more contextual, because there are different types of geography that we see across the state. And also the coverage that I think of treatment facilities across the states also needs to be equally distributed. So anyone else, anything to add on? We move on to the next part of the panel, where I invite Mr. Santosh and Anandita to talk about their journeys in Tamil Nadu and Orissa, who at one time had the same problem, and how to address some of the challenges, learnings, and especially what would be relevant for Kerala. Over to you, Santosh.
Thank you so much. I think in a way, the current work, what we are doing in Tamil Nadu, I hope I'm clear, audible. Yeah. So that will probably some of the things what we have done could be useful, but I also would like to start with a simple statement in Tamil. I apologize for not speaking in Malayalam. I hope you can understand what I am trying to say. I'll use a little bit of Tamil also. So whatever we have learned in Tamil Nadu is only a fest. What we don't know is the entire world. So I just want to kind of summarize the way Mr. Arun and Rajiv has said. So if I were to kind of move from where we are in Kerala, so we would like to minimize untreated waste getting into the environment. So by building institutional capacity, if I were to frame the outcome. So intermediate one is you build institution capacity and then minimize untreated waste. So and also I see that there is a substantial dependence on on-site systems, right? So that's the key thing here. We can think of n number of different ways with which this can be solved, but if you were to achieve the outcome of minimizing waste getting into the environment from all sources and now, so I think the first principle, the way with which we will approach is to build on existing what we have, right? So that's one of the simple way to look at it. So we have on-site systems, and then what are the key things that one needs to do so that we improve from what we have till we have other solutions such as sewerage or equivalent, right? So one could be, the way Tamil Nadu had approached this is it scaled on-site system improvement and FSM, so fecal site management. That is something which the state can definitely consider. But more importantly, let's not look at these pieces in isolation. So whatever we are trying to do is, let's look at the full cycle of liquid waste management. So we end up looking at bits and pieces, say access to toilets, for example, or FSM only, right? So all these 4 or 5 elements, the full cycle is represented in a very different way by different people. But what we are trying to say is, if you do not address any of the small pieces, then the solution is incomplete. That's the first and foremost simple principle that I'm trying to say. And also I said, build on existing strengths is that, for example, we have some form of desludging operations, which is happening, which is clandestinely disposed, for example. So then how do we work with them? So they are one of the key stakeholder here, right? So how do we work with them? So what Tamil Nadu has done is, what is the one important thing a desludging operator needs? A simple designated disposal facility at a reasonably good distance. I think that's one of the key things. So let's try and create as much as possible, right? And second thing is that for these players to operate, it's important that their operations are eased out and also they are not disincentivized, right? So they should not be disposing waste in non-designated spots. So how do you regulate them? That's the second key question. So one of the ways with which is everybody regulates them in a heavy-handed manner. Let's use a light touch regulation approach. What does this mean? I can elaborate a little bit on this. For example, one of the key thing is you need to encourage these operators to come and dispose in a designated facility by minimizing, say, for example, if you're charging them a tipping fee, right? So you keep it as low as possible so that they come and deposit. Let them get into a habit, right? So that's one of the ways with which, so you have desludging operators, but you regulate them in a light touch way so that the outcomes are primarily achieved. And second thing is that now we are looking at this at the state scale, right? So we have 14 odd districts, 100 odd local bodies, and we also have rural, right? So unfortunately, when you're looking at from the state scale, so I can kind of work on both the rural and urban together. So that's one of the scale thinking that will help you to kind of look at the problem in a slightly different way, right? So what does that mean? Is that if we have some sort of strategic thinking at the state level and then planning, right? So what will that help is you can try and use the scale advantage. For example, if you were to set up treatment facilities, or you have some treatment facilities which are already there, how one can make best use of them, and then some of these measures, what we're trying to do is mobile, right? So you have desludging operator who will move from place 1 to place B. So you can use a cluster approach. You can use one treatment facility serving X number of locations. So these are some of the things that are possible when you look at this problem at a state scale. But at the same time, we also need to have something which works at the lowest level. It could be a local body or a group of local bodies. Then what do we do there? So the scale advantage, if the state starts building on it, that will be really useful. And what is also important when you start looking at this from an institutional perspective is that you have multiple departments or so-called verticals. They can start talking to each other. So the simple mechanism set up by the Tamil Nadu state is that you have a so-called advisory committee which was set up specifically to accelerate liquid waste management implementation and operationalization. So it had multiple, say you have a parastatal which provide sewerage services, you have ULBs together cluster, so which is managed by Department of whatever, Urban Affairs equivalent. So all of them come together. One of the key hurdle is that how do you collectively make decisions, right? So that was something which was eased out, and the decisions were made fairly quickly. And also, more importantly, you have to monitor what's happening to those decisions. So this advisory committee in a way helped to accelerate the scaling. So the state scale view is important, and that worked fairly well in the case of Tamil Nadu. And also, when we are looking at scale per se, I'm not saying that everything can be scaled. You also need to have differentiated solutions, which are very well highlighted by Rajiv, saying that we have marsh, swamp, we have low-lying areas, we have urban poor, right? We need to have some sort of a differentiation, understand what exactly the problem is, and then come up with right solutions for that. So that's also equally important when you're thinking about scaling. That's largely the approach that when we were trying to scale non-sewer, the so-called FSM in Tamil Nadu, which is part of the Tamil Nadu Urban Sanitation Support Program. And IHS led this program for the past 7 years, and we have achieved to some extent a good progress, significant progress. Some highlights are, for example, when we started in 2015, we hardly had one fecal sludge treatment plant. Now we have close to 56 in the span of 6 years, with COVID also being there, out of which 25 are operational, and it is catering to the tune of 15 million. So that's the thing that we're talking about. Tamil Nadu also had this distinct advantage of running SCPs, which was used for co-treatment. The way it was thought is that let's not create infrastructure, but make most of what already exists. So when we have this kind of implementation strategy of keeping the services as the outcome, right? So you have the service provision as the key thing, plus make it work, right? Operational sustenance is the key question. So it's important for us to kind of ensure that we utilize whatever we have, build on that. So that's the key thing. So STP co-treatment was something which was practiced fairly well, and it is working really well. We have nearly 42 STPs co-treating, and then we have standalone FSTPs constructed around 56 of them in a span of 5 to 6 years. And then I'm not saying that, again, I'm coming back to the OIR's quote, that state has made significant progress, but still a lot to achieve. So, and I would like to, since it's on-site at the moment, right? So till we have certain things in place, how do we work with on-site systems and FSM? So I'd like to elaborate a bit along the full cycle of sanitation. So when you look at on-site systems, right, largely there are two categories, right? Individual household, and then you have large ones, right? So when you're talking about large ones, so they are regulated either by the environment, from an environmental regulation perspective, or by planning authority, right? So both are there. So let's try and understand what is the volumes of waste that these are generating, because these are large point sources. It's easier for us to kind of regulate them. Let's target that. One of the good success from Tamil Nadu is that we have large number of community and public toilets, which is also a significant source of fecal waste and fecal contamination, right? So we have introduced scheduled desludging in community and public toilets. There you are in a way trying to address the point which Rajiv had raised. People living in low areas, typically they are poor, and service provision is definitely ignored. So if you were to be inclusive, right, you can try and introduce things such as how do we better manage community and public toilets. It is also part of the SBM and Amrut. So there are a lot of initiatives that are being carried out under that. So that's one. Now the second thing is you also have commercial establishments, institutions, all of them. So unfortunately they're falling through the cracks because environmental regulators are unable to focus on them because their focus is elsewhere. So, and also the urban local authorities or the rural local authorities are unable to manage them. So we need to have some sort of an action planning and then try and make it work. The solutions are pretty much there. I mean, if you look at the Expo, there are X number of technologies which in a way tries to address the waste treatment related questions. That is fairly implementable and it is low hanging, it's being tried. So that's the other one. And the third most important thing is you have many scattered individual household on-site systems. Then how do we manage that? So one of the ways with which we have to think through is let's try and secure the new ones first. So whatever is constructed newly, which will be part of the building approval process, let's try and address that first through whatever building approval methods that you have. And also let's go back and then look at the on-site standards per se, and then look at their functionalities and how this can be kind of implemented. I think that is something which is fairly simple, but implementation is a big challenge. So there are different ways with which institutional capacity can be built around standardization of process, right? So all of that. So that's the second point. I mean, I'll just move on to the next one. On the collection and conveyance side, so I talked about light touch regulations, but you also need to see where collection and conveyance service is currently not being provided, right? So for those local areas or local bodies which are managing these kind of services, we can introduce by procurement of some sort of a truck and then probably look at other models, including privately operated or SSG-led models. So that is something which has worked in Tamil Nadu. And when it comes to treatment, I'll go a little bit thing here. So we have to ensure that we design these systems for operations, right? So that's one of the key things. It is very, it's typically missed out. We have to design these systems for operations. And what Tamil Nadu did is, it invested on quality assured implementation, apart from usual tendering, all of that, right? So how do we know that these are built according to the quality specifications? So it had set up a separate quality assurance team which used to kind of monitor. So that's why it could scale 50 odd treatment systems which are built out according to the standards, right? That's one. Similarly, when we are looking at the so-called implementation, we somehow look at the capital only. So let's try and look at the life cycle of it, the cost of the life cycle, right? And typically the way we have the funding pattern is that, so you have substantial push and also availability of funds for construction, whereas when it comes to O&M, it may not be there, right? So some ULBs do not have, so then how do we manage that? So in a way, one of the simplest way is to, now everybody is following that, is you integrate O&M with the construction, right? So that's one way of addressing. But what is also some ULBs are doing is that they are investing on low O&M systems, right? So that is something which one can try. And we also had a lot of challenges associated with this. You want me to stop? Yeah. Okay. I mean, what I'm trying to say is let's try and look at what funds available, and let's keep the O&M costs also in mind when you are trying to design these systems and implement them. So, and there are other cross-cutting themes. Probably I can talk about it a little later. Thanks.
Thanks, Santosh. So if I draw a parallel between what happened in Odisha, sir, and what happened in Tamil Nadu, Odisha is one of the least urbanized countries of India, and that actually came in handy as an opportunity for Odisha themselves to plan. So when we started, Odisha had only 3% sewer coverage. Only the large cities of Bhubaneswar and Cuttack were covered through sewerage and were catering to only 3% of the population. And so very early around 2015, through a lot of research and understanding of disaggregated data, etc., they had the opportunity to do that. They found out that their river water is very heavily contaminated with fecal coliform. And there was a lot of NGT and CPCB pressures to adhere to norms and clean up those river stretches. And FSM kind of emerged as the most pocket-friendly and friendly option, quick option to cater to. And Odisha went ahead and decided to build 180 for all its urban local bodies, 15 urban local bodies currently, to be covered with FSTPs, what we call fecal sludge treatment facility or septage treatment facilities. And the initiation was interesting. The Odisha forged a partnership with Bill and Melinda Gates Foundation, Aragyam, Center for Policy Research, as well as Practical Action, who acted as the local partner, and CDD, the technology provider, who came together to demonstrate on a pilot basis a solution in two small towns of Odisha, Angul and Dhenkanal. And as these facilities were constructed, the state kind of got convinced that this is possible, and the Odisha Sewage Board picked this up and build the rest of the FSTPs. 2018, they kind of started operations with 8, and as we speak, they have more than 100 operational FSTPs, which are constantly getting served by servicing the populace of the urban areas. And for the conveyance and what Santosh was saying, Odisha, for both conveyance as well as the functioning of the fecal sludge treatment facility, Odisha is heavily invested in building capacities of their self-help groups, what they call Mission Shakti groups, which is a counterpart of your Kudum Shri women health groups, where these area level federations and interested self-help groups are actually operating the conveyance vehicles, which are leased out by the municipalities, and also the fecal sludge treatment facilities themselves are being managed by those self-help groups. So the other thing that I think one of the crucial learning from Odisha is how to de-technologify these facilities, so that, as Santosh was saying, that build them to operate. So how do you decouple the very complex technology-led solutions than very simple nature-based or simple technology-based solution, which can be very efficiently managed. One of the important outcomes with which I will close this, and we can discuss further what we learned from Odisha, is in 2022 and 2021, both those years, the CPCP data actually indicates reduction in total coliform pollution in the river stretches for which this intervention started. And the waterborne diseases have significantly decreased. So these are two public health outcomes that Odisha is reaping benefit from. And one of the challenges that both you and Rajiv, you mentioned during your talk on the challenges that Kerala face, I think one of the ways to solve those challenge of land, access to land, the NIMBY problem that you raised, I think exposure visits are very important, more for the local councillors, local people. These facilities are actually odorless and very, very sanitized facilities. Please go and organize visits to see them. Both in Tamil Nadu, please go. I'm inviting on behalf of Santosh to Tamil Nadu, all of you. Please go to Orissa. I think seeing is believing. One of the ways to cater to this NIMBY effect is through this. And just to end that, even in Angul, which is one of the smaller cities, we had immense challenge in mobilizing land. And there were court cases which were fought and won by the government by kind of showcasing how these facilities will actually look like. And these are sanitized facilities without any whatsoever impact on nearby populace's public health. So, with those points, I will end, and I'll come back to the crucial learnings as we go forward in the panel. Thanks.
Anything else anyone wants to add on other states?
I'll just like to add that I'm glad already, like whatever Santosh has mentioned and you have mentioned, we have already started working on few of this matters, in the sense I'll start from the exposure visit part. Already in month of February and March, we are sending all our not all, at least all our standing committee chairpersons. That is like in Kerala, all of our local bodies have standing committees which are headed by elected councillors. So all of them will be visiting Odisha as part of the exposure visit. So hopefully they'll learn from what they see, and that will make them believe. Also, like Santosh has already mentioned, the co-treatment facilities, that is something which we are trying to tap in already in Kerala, like the existing plans, and any plant which our water authority, which is our sanitation authority also, is building. We are ensuring that co-treatment is an essential part of the design. And while we design those plans, we are keeping in mind the fact that because of the semi-urban nature of Kerala, we need to cluster our local bodies, be it panchayat or be it municipality. We are trying to, I'm pretty sure, like even the Shruta Mission, that is our Swachh Bharat nodal agency, while they are designing the plans, we are locating them in such a way that they are accessible to the nearby local bodies also. Finally, the operations part, we are now shifting to a model where DBOT models are preferred. We ask the contractor or whoever is presenting the plans to have an operations plan also for at least 5 to 10 years, so that the plan keeps running. But the only concern which I would like to raise at this stage is regarding the feasibility or the possibility of having nature-based solutions in Kerala, especially in the urban context, because since we are on this topic, how feasible is a nature-based solution in Kerala, where, like he has already mentioned, getting land is difficult. So we have found that even for getting in 50 cent of land for FSTP, that is difficult. So how do we go about building a nature-based solution? So that is just something which I'd like to flag at this stage.
Okay, I think the key challenges are, the similar, where Orissa faced a lot of backlash due getting land for that FSTP, and similarly faced by Kerala. I think the key strategies that come out, I would say that there has to be a strategic plan at the state level, where you are looking at a lens which is agnostic about, urban or rural. So there's a urban-rural convergence where funds can also be sort of converged to come to the outcome that we are looking at. And of course, we need institutional capacity, as Mr. Arun said. That is, I think, building up the institutional capacity to deliver the service to the citizens. That is important. Looking at cost from a life cycle costing basis, not only capital cost, but also the operations and the whole total cost of ownership as well. And having a quality control mechanism, I think very important when you are implementing at scale. I think that is a key thing. I think Tamil Nadu has, has the protocols in place, and Kerala doesn't have to reinvent. There are a lot of things that can be taken directly from Orissa or contextualized very quickly to scale up operations here. And I think the technology part will be context sensitive, and I think there will be need for some sort of a suitability analysis using GIS, and Kerala is very advanced in use of GIS, drone, etc. So I think use of those, and how do you sort of contextualize technological solutions, and I think that is very important. And yes, exposure visits to start the advocacy for local urban local bodies, and also it could be some of the local resident citizen groups. They can also be sort of be exposed to how it looks, how it feels, it does not smell. Those are the concerns that they have. So if we could, arrange those, that would be great as a starting point. Next, I think I will call upon Mr. Uday to talk about sort of the backward and the forward linkages of liquid waste management, where you have the river, where it flows to, and also, solid waste that is also part of our liquid waste, right? So if you can address that in your work at Namame Gange. Thank you.
Namaskar everyone, and thank you very much Vashai for this wonderful opportunity. So it is said that humans started to develop, living along the river's banks. So rivers are called as the cradles of the civilization. And, slowly and slowly the human settlements, the hamlets grew, they became villages, and then slowly and slowly they took the shape of cities, urban areas. And we know that, cities are, attracting a lot of people from the surrounding area. What I'm trying to say here is that the water sources, whether it is a river or a lake or a water body, that is preferred by human being to, settle down and to grow and to flourish. So there was a strong connect between the people and river at one point of time. But whatever discussions right now we are overhearing, it is clearly indicating that as the human settlements grew and took the shape of the cities, big cities, the cities started to dispose their wastes in the natural environment. That is our rivers, our water bodies, our wetlands, our marshes, and so forth, and so on, right? So there is a disconnect between river and people. Perhaps maybe in the Kerala, because the water is so much flowing, there is a still connect between the people and river. But if you look at the other part of the country, the rivers are perhaps dying. I mean, rivers and water bodies, they are ultimately becoming the dumping yards. If you look at the floodplains along the river banks, they are becoming the dumping places for the solid waste management or solid waste. The solid waste treatment plants are, constructed along the river banks. Sewage treatment plants, they are constructed along the river banks, right? And because that's the ultimate disposal point. And importantly, the floodplains and other natural buffer areas are captured. So we are trying to kill the rivers, right? In the face of a development. Here, like what exactly is required is certainly infrastructure. For what we are talking, like we certainly need liquid waste management strategies, solid waste management strategies, and certainly will require infrastructure for that. Will require sewage treatment plants, will require solid waste treatment facilities. But there is certainly a need to go beyond that in the form of a holistic planning. That is called as like how we can holistically think that we can conserve our water bodies and rivers. So what are the solutions for that? So 2019, we actually worked with the National Mission for Clean Ganga on this aspect, that how cities planning can be improved with some kind of a instrument or some kind of a framework that can help cities to actually manage their rivers and water bodies. So what I have on the screen is a kind of a framework, guiding framework that can help cities to actually, take care of the rivers and water bodies. So the framework has fundamentally three verticals that you can see on the screen are environment, economic, and the social. These are the three broad verticals which are also completely colliding with the sustainable development goals. And each of this element has a vision, like environment. When you say environment, when you say river or a water body, what you see? The river is thriving, fishes are there, there is a biodiversity thriving, then you call that river as a live river, right? When you say economy, the river has to generate economy. It has to provide avenues for cities or urban areas to have economy. And of course the social, because one of the important things is that more and more people are connected to this particular natural environment, whether it's a river or a water body. It will not be, people's participation will be very much important. So social element is having that vision that people are connected to the river. Ultimately, that is the goal. Under each of this element, we have 6 broad objectives. For example, when we say environment, it starts with the planning first objective that says the floodplain should be regulated. Activities in the floodplain should be regulated. The encroachment or whatever we say, how we can do that? The cities have a master plan. The Kochi will have a master plan. The Trivandrum will have a master plan. Many other cities will have. How we can make our master plans more river sensitive so that they can imbibe, they can include the development control norms or regulations that can protect our rivers and they can keep them healthy over the period of time. The second part is the pollution abatement. We are all talking about the pollution abatement strategies, like whether it is a liquid waste management or a solid waste management. How we can control the pollution is the second objective. Third is the wetland and water bodies. Like we have, each city is dotted with the water bodies and wetland. How they can be protected. So the environmental objective talked about that. Then recycle and reuse. We are emphasizing more under the Amrut mission, under the Smart City mission, under the Swachh Bharat mission. We have a more emphasis on how we can reuse and recycle the element. So this is the one of the core part of the element. And importantly, how we can actually give back the water to the river from the city side. Here maybe rivers are flowing. The Ganga is also flowing. But if you go to the Rajasthan, if you go to Madhya Pradesh, some part, there are no water in the river. How cities can responsibly contribute the river to the cities by meeting the recycle reuse demand. And the riparian buffer. Each water body has a buffer zone. So these are the 6 core objectives about which the cities can plan their strategies. The economic objectives talk about how we can leverage the economy, how we can actually make the eco-friendly river fronts so that people can go and the river fronts become eco-friendly. And the social element talks about how people can be connected not only for the awareness, but also for involving them in the management strategies. Like you can, have a kind of a amateur college group or students to do the amateur water quality testing so that they become more responsible. You can have trails along the rivers, how we can engage citizens in the river management. So these are the core pillars. Now each city till this point can have a common objectives, but from cities to cities, the issues and challenges will vary. So cities will have to plan the projects according to doing the baselining based on how they can assess under each of this objective, how the city is placed, and then they can actually plan the projects and they can secure the finance. And importantly here, the finance is not to be separately secured. You can link all the projects with national missions, whether it is Amrut, Swachh Bharat mission, or any state level mission, 15th Finance Commission, and we have a strong monitoring and evaluation indicator for this. So overall, this is a holistic plan that cities can adopt at the state level or a city level to improvise the river situation, and the liquid and waste management is also part of this particular strategy. And this particular frameworks are available along on the website of a National Institute of Urban Affairs. So anyone can go on the NIUA website. They were launched by honorable ministers last years, and there are also alliances formed, River Cities Alliance, which cities can be a part. So sir, this framework can be a guiding instrument for cities to improvise the river and water body situation in their cities. So here I'll stop and maybe we can have a more additional remarks on this. Thank you very much.
Anyone has anything to add to this river management?
Just one point to add. You mentioned the planning process, right? Now, everybody knows Kerala as a people's plan state, in which our plans at the local body are made by the people. But as far as I understand, a master plan, which is made by the Town and Country Planning Department, does not have that kind of, involvement and participation, right? Whereas the development plan, which is managed by the local body, has extensive consultations at Gram Sabhas and, even with specific stakeholders. But in very few places do we see the infrastructure plan. So whether it's roads, whether it's something related to the rivers. Because when you go and talk to any village or local body in Kerala, the person or residents near the river are very clear on what is an active river, right? And what they have seen and how they have seen the river change. But then somehow our planning systems are not able to bring this in.
Thank you very much, sir. So this particular framework is not the theoretical framework. I missed to add that we have prepared India's first urban river management plan. Maybe I can request the for the next slide. So this urban river management plan is prepared for the Kanpur city, and which was also launched by Honorable Minister last year. This plan exactly talks about what sir is saying. It asks cities to form an advisory group which is constituted of different agencies like planning department, municipal corporation, parastatal agencies, and also the academia. And this advisory group actually steer the urban river management plan process. So there actually we can break these silos, where usually planning body doesn't talk to the municipal corporation, or municipal corporation perhaps has limitations to talk to the jal the parastatal body which supplies the water. So advisory group can be formed, which and that is the part of this URMP process which we are trying to work in the other cities. Like we are preparing these plans for Moradabad, Bareilly and some other cities. So advisory group can hold this all stakeholders together. Thank you.
Okay, we move on to the next aspect that is very important, and is about private sector involvement. We've seen so many private sector entrepreneurs here in the Expo. How can private sector ecosystem, how can this be developed in the state? And Mr. Sunil will talk about, what are the challenges or the barriers for entry of private sector, and what are the incentives that can be offered by, by governance mechanisms or otherwise for private sectors to get involved in the sector. So over to you, Sunil.
Thank you, Sujaya. So the first question that I ask myself when we talk about public-private partnership is, why do we need to involve the private sector? Now we heard from the experts now that only 2 or 3% of the city population is served in terms of treatment. Now, can the government do it on its own? Definitely it can do it, but the question is the time that it would need to reach out to 100% of the population. Now, where the private sector comes in is the private sector would help work hand in hand with the government to achieve this scale at a much faster pace. Also, we need to accept and understand that most of the innovation would come from the private sector. I'm not saying it doesn't come from the public sector, but yes, it does. But the private sector, because it sees an opportunity to address an untapped market, the private sector can contribute there and can come up with innovative solutions. One such example I'll give you here is the Bandicoot that we saw as one of these stalls. It definitely helped in addressing the challenge of manual scavenging, where they are using the robotics to do manual scavenging and thereby bringing dignity to the life of the sanitation workers who is actually involved in cleaning the drains or emptying the septic tanks or such things. So the private sector has definitely a role, and here we also know that SBM 2.0 and Amrut 2.0 definitely have created space for the private sector participation by ensuring that in the guidelines there are certain percentage of the total projects that need to be done through public-private partnership. Now, we as an organization, we work with a lot of entrepreneurs who come up with innovative solutions to address the sanitation challenge across the entire value chain, right from access to toilet to treatment and reuse and then disposal. Now, what we understand from the entrepreneurs is what are the challenges that these entrepreneurs face when they are working with or on projects which are related to public-private partnership. One is the way the contracts are written. Usually it is through L1 and then the qualifying criteria that these entrepreneurs need to have certain number of years of experience. They need to have certain financial turnaround, like 50 crores should be the annual turnaround for the last 3 years. Now, if you have small and medium entrepreneurs who are coming up with innovative solutions, they definitely automatically get cancelled because they do not qualify on those criteria. So that becomes one of the biggest challenges for the private sector. Secondly, in terms of making the urban local bodies understand how the solution developed by the private sector participants is a long duration. Usually it takes about 8 months to almost 18 months to convince the urban local bodies to see and look at the solutions and get convinced about it. Once they are convinced, to actually get to the paperwork in terms of a pilot, the biggest challenge which has been acknowledged by this panel is how do you get access to the site? Whether it is building a public toilet, community toilet, or a treatment facility, getting the land or the site approvals is a Herculean task in itself. So that is one of the biggest challenges also the entrepreneurs face. Thirdly, wherever there is a private sector working in partnership with the public sector and where there is revenue that is dependent on the public sector, the payment schedules are so delayed, then it becomes a challenge. In spite of sanitation being acknowledged as a priority sector for lending, there are challenges because if the major revenue is dependent on government revenues, then a formal bank will not give or bank that particular project because of the erratic payments or the delays in schedules of payment. So there is no confidence for the formal sector to give or sanction a loan. So that becomes one of the biggest challenges. So these are some of the things, and then private sector will only come when there is an opportunity, when there is money to be made. So private sector doesn't have to be looked at with suspicion by the public sector. I mean, you need to develop that kind of confidence that we are working with each other to ensure, the way the contracts are also written. Like, for example, the government talks about how the private sector person has to pay the minimum wages to the employees and also pay their PF and all, which is great. It needs to be done. No question about that. But what happens if there is delay in payment? What kind of risk or what kind of penalty that the ULB is willing to take it upon itself when it is delaying the payments, right? So these things need to be looked at. Now the question is, I have told you about what are the challenges, but how do we ease these challenges? So some of the things is also look at, probably there are already model contracts that have been developed. I was looking at the material developed by Wash Institute. There are wonderful model contracts that have been out there in the public domain. The urban local bodies need to look at those and customize those a little bit according to the local context and also work on those. Secondly, while you are looking at national level solution providers which have been certified by, let's say, the Principal Scientific Advisor's Office to the Prime Minister's Office or if the Mashelkar Committee, whichever such national level committee has already registered and approved those technologies, the states don't have to insist that they have to prove the technology again at the state level. We still live in the same one India, right? So what is acceptable at the national level could be acceptable at the local level also. So these are some of the things that needs to be looked at? I think I would stop perhaps and then.
Yeah, I think we are running out of time. I think, thank you, Sunil. I think you sort of put on exactly what we were looking at, is what are the challenges and the incentives, sort of. So all of the different strategies that we've talked about cannot be accomplished without stakeholder participation. I think Anandita talked about partnership, critical partnerships within the government with the different departments, as well as the stakeholders, starting from, the SHGs, the citizen groups, very important, academia, NGOs, research institutions, even agricultural universities, who are critical partners to this solution. So I think we can talk, 2 minutes or one line on, how Tamil Nadu has engaged with the partnership model, and also Anandita, if you can talk about a little bit about the partnership.
Yeah, so 1 minute is too little. You are already going to Orissa. I'm sure you will learn much more than I could possibly tell in 1 minute. I think one of the critical ways that Government of Orissa came up with, I'm sure you've heard, and Kerala has been the pioneer for an urban wage employment scheme that came in the wake of the COVID-19 crisis. And since then, I think this mentality of going beyond contractor-led models of service delivery and maintenance of infrastructure, they have gone beyond that and kind of mainstreamed the self-help groups as the critical service delivery partners, is really yielding result as of now that we see. And with Kudumshri right there, and the amount of capacity, in-house capacity that Government of Kerala has, maybe looking at Kudumshri with that lens will be very important when you start forging partnership. I've actually listed down a few things for the 1,000-day plan, so I'll go to that later and I'll hand it over to Sant.
Okay, so one of the key thing is, where do we want to partner per se? So when we talk about liquid waste management, right? So of course, so one is the SSG-led model, which is being tried in multiple areas, including community and public toilet operations, right? So one of the key service provider is sanitation worker. So how do you engage with them, right? So that's one of the key things, both on the social protection side and also on the safety side. So that's something, there's a lot to learn from Tamil Nadu. The other thing is, we have created NGO platform per se, so which is in a way is very important for us to leverage many things with that. So this includes communicating about what do we want to do and service provision also. So NGO platform is an ecosystem that we would like to, I mean, there's a lot of things that we can talk about. Tamil Nadu exposure is a suggestion for all of us, right? So I'll stop at this.
So I would just like to go back to what Uday had mentioned about the river advisory committees. So I'm not sure whether this exists in other states. There is this, we have at state level a river rejuvenation committee which monitors major water bodies of, including rivers and the backwaters of Kerala. So I think what I could sense from what you are saying is that we need to localize them so that the participants, the stakeholders at the local level, say along the stretch of the river, so the municipal chairpersons or the elected representatives, the residents associations, they need to be involved, and including the technical agencies who might be able to help with both the solid waste and liquid waste which is going into that, and come up with a plan which will help them in a long term or in a medium term, will help them to ideate and implement a plan which would clean up their river. So that is something which I wanted to mention regarding what you had described. Otherwise, I would like to just mention as part of Amrit, since I'm a mission director Amrit also, we have been constantly being pushed to engage with startups who are bringing in innovative measures. And like he has mentioned, the startups are empaneled by Government of India. They do a thorough check of the feasibility of their technologies, and once they are they're found feasible. They're mapped to different states where the state mission units are facilitating them to engage with the local body. So hopefully over the next 5 years, we'll see these technologies blooming in different local bodies, because multiple startups are being engaged in different cities of India. So hopefully like we'll get to learn from the experiences of different cities, and we'll have a set of technology partners, private partners whom we'll be able to engage. As far as SSGs are concerned, like you all know, we are one of the leading states. So already in solid waste, we have been able to effectively engage the Kudumbashree SSGs. We have a special green army, it's called Harita Karma Sena, which is a green army which takes care of the solid waste. They operate the facilities as well as do the household collection and segregation also. Recently we had launched a smart mobile application which tracks their collection facilities and the segregation quantities and all that. So similarly, leveraging their capacity to manage the liquid waste management facilities as well as the mobile units which collect the septage, probably that will be the way ahead for us in engaging them in the liquid waste. So I think that would be something to think about in long term. Thank you.
Okay, the last question for the panelist is, okay, what is the to-do right now? We have talked about a lot of strategies, challenges, etc. So for the next 1,000 days, what the government of Kerala can do realistically? It is doable with the experience of Tamil Nadu and Orissa. Can we come up with, 5 points or whatever? 2 points each maybe?
I think I'll go back to Arun's opening salvo, let me say, of institutional capacity. Now that's something which everybody speaks of in a very general context. So if I try to pin it down to Kerala, it is that there are a lot of things which have been spoken in the panel. So you need partnerships, you need planning. So planning about the river, but involving the resident who is near the river. So those are things which, in a certain way, the ULBs are capable of. And they have been doing it for certain other programs. But the thing is that you need a structure for that process to happen, and you need a continued partnership from the state, whether it is through some agency or through the state. I mean, you don't see it happening, or, how do I put this? It has to happen for a sustained period. And then it becomes, like we have seen it in other programs. We are possibly seeing it in the solid waste management program, which is taking off in Kerala right now, where the ULB is supposed to develop a master plan through consultation. But it requires a certain time frame, and that sustained support to that ULB for that time frame is, I think, critical.
So I think, let's say that, all the urban local bodies and the local self-government departments accept that we have to work with the private sector at the appropriate locations, appropriate areas, but also develop a framework in terms of how to engage the private sector. I think that is one thing which would really help, and other states can pick it up from Kerala if Kerala can take up that leadership in developing this framework on how to engage the private sector.
I'll finish and give it to you. So I think I'll go with 2 points. One is plan well. But when I say plan well, I don't mean that, you do all the data collection across the state and then start work, but plan well on the go. Collect local intelligence, build on those, involve institutions who already have data, build on those, and identify quick wins so that you can convince. Quick wins are also part of the institutional, cohort building. So if that can be done, then that will be very good. And on the go, if we collect additional evidences and see how those additional evidences can guide our more localized solution, that's one. And the other is, I actually would like to echo what my co-panelists already have said, a robust policy and legal framework that can guide this implementation going forward would be very, very crucial to begin with in the first 1,000-day plan or 100-day plan. And these two, if we do well as a starting point, I think we are off to a great start. Thanks.
Yeah. So here I would suggest that maybe it is very much important because everyone is believing that there is a sustainability is required, continuity is required. So if there is a dialogue series initiated, maybe at the the state level, which also involves the ULBs, because ULBs are the ultimate unit which will implement this all things that we are discussing. So maybe a dialogue series in the form of a, either the training program, capacity building, or in an informal way. At the same time, for the people also, for the communities also. So series of dialogue will certainly help to constantly remind official as well as the citizens that how they can protect their natural resources and do the wonders.
So I will just echo what Rajiv said. So we need a structure, agency, and a sustained period. So maybe 3 years, 1,000 days, right? So I think that's important. So you need some sort of an agency which will push this and then continue to kind of look forward. But what is also equally important is you have a friendly neighborhood. So don't repeat the same mistakes, please build on them. So what is also equally important is let's try and address the concerns of uncertainties of climate change, for example. So let's ensure that we build resilient systems. So that is something which we are also learning, and we can learn together and then ensure that we reach the goal as early as possible.
Thanks, everyone. And I think now we are open for question and answers. And before that, I'll just summarize a little bit in 1 minute, in 5 points. I think what comes immediate that the state government can look up is set up a advisory committee like Tamil Nadu, something on those lines, which will actually push the agenda. And this can be an agile, we are also looking at sort of a agile planning framework where there, as you learn, you go, plan, you on the go, and still make changes as you build evidence, more knowledge, you do that. So that is, I think, also very important as done in Orissa. Then protocols for how do we bring in private sector, how do we build those partnerships, how do we build that trust with the partners. I think that is very, very critical as we go. And this is all sort of contributing to better governance, better institutional capacity, etc. A capacity building program is also very, very important. And last but not the least, what Rajiv said is whatever we do, we need to see that it is sustainable, it is continued for a longer period of time. So there is certainty in the partnership, in whatever everybody. I think that is a very important thing, and I think the state can push that with a little bit of funding, and funding is not an issue as I understand in the state. So these capacity building for the states, for the ULBs and the panchayats would be, I think, to build up this capacity is very, very important. And we have the NFSSM Alliance where a lot of work is being done, and WashEye has also done a lot of work where, for example, the protocols for models for partnership, private partnership, and others. A lot of work has already been done, and of course Kerala can use those knowledge products, capacity building programs to enhance. So I would stop at that, and any questions from the audience?
ഗുഡ് ഈവനിങ്. എൻ്റെ പേര് ജാക്സൺ എന്നാണ്. സാറേ, 2% മാത്രമേ സെപ്റ്റിക് വേസ്റ്റ് കേരളത്തിൽ ട്രീറ്റ് ചെയ്യുന്നുള്ളതെന്ന് കേട്ടു. കേരളത്തിലെ എല്ലാ വാട്ടർ ബോഡിയിലും ഈക്കോളി ബാക്ടീരിയയാണ്. അപ്പോൾ എവിടെയോ നമ്മൾ തെറ്റിയിട്ടുണ്ട്. നമ്മളിപ്പോഴത്തെ സിസ്റ്റം മാറ്റേണ്ട സമയം കഴിഞ്ഞു. ഇപ്പോൾ ചെയ്യുന്ന യുണൈറ്റഡ് നേഷൻ്റെ ഒരു സിസ്റ്റമുണ്ട്, എക്കോസാൻ ടെക്നോളജി. എനിക്കറിയില്ല ആർക്കൊക്കെ ഇത് അറിയാമെന്ന്. എക്കോസാൻ ടെക്നോളജി അത് വാട്ടറിൽ ഇത് ഡൈല്യൂട്ട് ചെയ്യാൻ പാടില്ല. സെപ്റ്റിക് വേസ്റ്റ് വാട്ടറിൽ ഡൈല്യൂട്ട് ചെയ്യാൻ പാടില്ല. ആ ടെക്നോളജി ഇംപ്ലിമെൻറ്റ് ചെയ്ത് കഴിഞ്ഞാൽ വിത്തിൻ അവേഴ്സ് വി ക്യാൻ കൺവേർട്ട് ദി സെപ്റ്റിക് വേസ്റ്റ് ഇൻ ടു എ വാല്യൂ ആഡഡ് പ്രോഡക്റ്റ്. ഞാൻ ചെയ്തിട്ടുണ്ട്. within hours, within 5 to 8 hours, we can convert the septic waste to value-added product in slurry form. Because it should not be diluted with water. That solution can be converted into organic manure within 4 to 5 days in dry form. That inoculum, we are using Lactobacillus planturam. It is in our body, it is there. It is a digestive bacteria. It will not permit the E. coli bacteria to sustain. So I have a startup company. So I have done it in my house in a small quantity. So if the present system is not environment friendly. So if I get a chance, I can prove it.
Okay, thank you. Thanks to noted, yeah. You have your stall here.
No.
Okay, good to know. Yes, any other questions for the panel that you want to be answered? Okay, if there are no questions, we will end this session. Thank you, each of you, for spending the time and giving us the valuable insights. Thank you, Santosh, Uday, Anandita, Sunil, and Rajiv. Thank you, Mr. Arun, and for the time here.
Thank you so much, all the panelists and the chair, for this insightful session, understanding the challenges, opportunities, and also at the same time zeroing down, scaling it to the most important steps to be taken by the state in the first 1,000 days. Before leaving, I would like to request Arun sir for providing mementos to the panelists. First the chair, okay. The chair is last. Rajiv sir. Sunil sir. Can we have a round of applause? Thank you. Sujaya ma'am. Anandita. Uday sir. And Santosh sir. Last but not the least, I would like to invite Praveen sir on the stage to felicitate our chair for his support and his time for this panel discussion. Thank you everyone for your time. Thank you. So we'll have a 5-minute break. If you want to use some refreshments, you can just go out and we'll start the next session after 5 minutes. Meanwhile, if any of you have not registered, in the audience, if you have not registered, there is a QR code just behind you. You can scan it and fill the registration form. We'll share all the reference materials over your email. Thank you. I would now request the audience to please be seated, and we'll have the next session. These are two talks. The one is on sustainable wastewater management, and the second one is on the low-cost resilient structures in liquid waste management. Yeah, it's there in this. Sorry? It's a new pen drive. Oh. What should we do then? Okay, so no, we want this one and this one. Yeah. Yeah, yeah. This you can have, but first is this presentation. How should we do it? Yeah, yeah, yeah. Oh, okay. All right. Move. welcome back. Moving ahead to the next session, we have two talks. One is on the sustainable wastewater management strategies, and the second one is on the low-cost resilient infrastructure for liquid waste management. For both the sessions, I would like to now invite Mr. Praveen sir to please come up on stage as a moderator. A brief introduction about Sir. Sir is the Director for Liquid Waste Management for Shujitva Mission, and he's leading all the initiatives in the liquid waste management sector for the state. So I welcome you, sir, for this session. Thank you. I would like you to speak a few words for this.
Thank you. Good afternoon, everybody. I'll not spend much of time describing because we are eagerly waiting for the invited talks. I'll just say that as you have heard on the discussion from the previous sessions, that the gap between the wastewater generated and the wastewater treated is a very huge gap in Kerala. And regarding the infrastructure, if you see three terms which are critical for the infrastructure of any wastewater management is sustainability, resilience, and the cost. And normally these three are related. When you go for a sustainable and resilient structure, probably we think that the cost part increases. But now we have two talks on the sustainability of wastewater management and also on the low-cost resilient structures. And we are happy that it is both these talks are from the IIT, wherein it is known as the knowledge hub where the innovations and ideas of incubation of ideas happen. And we have two eminent professors from IIT Madras and IIT Bombay, and Madam is a Malayali, so I think she may speak in Malayalam also. So I am not taking much of time. I am just inviting Madam Liji Philip for her talk on sustainable waste management. Welcome, ma'am.
Thank you so much, sir. I welcome you, ma'am, for this session.
Good evening to all. Namaskaram. I will talk in English and try to explain once in a while in Malayalam because technically, yeah. Okay. Good evening to all. So I'll be talking on sustainable wastewater management. Okay, mostly whatever we have done in Tamil Nadu because IIT Madras is in Tamil Nadu, so that is what I am going to talk about. But we can have discussion about general things after the talk. So all of us know that water stress is there everywhere, and globally the withdrawal of total renewable freshwater is around 18.4%. But കേരളത്തെ സംബന്ധിച്ചിടത്തോളം ഇത് അത്ര കാര്യമായിട്ടുള്ള കാര്യമല്ല, കാരണം ഇവിടെ ഇഷ്ടംപോലെ റിവേഴ്സ് ഉണ്ട്. ബട്ട് we have to have our wastewater management or sanitation system climate resilient. So in such cases, we know that we get lot of flooding, and at the same time, come March, April, May, there will be flooding also. So we have to protect our water sources, and this is the general thing about India. This is Niti Aayog report. Most of the cities are having water stress with respect to quality or quantity. When we talk about Kerala, it is the quality problem, not the quantity problem most of the time. Then, we know that all over the world, less than 50% of the wastewater is getting treated, and no data is available from 101 countries, including India. And this is very important. India ranks 120 among 122 countries in the water quality index. That means most of the water in India are contaminated, and about 70% of the water is contaminated. The reason is, if you see, the wastewater treatment capacity in India is less than 30%. And in Kerala, it is less than 10%. So most of the water is getting discharged without any treatment. And especially, only the major cities around 70% is getting treated, otherwise nowhere else it is getting treated. And when we, this is very, very important, when we talk about wastewater is getting discharged into the rivers and water bodies, we were talking only about fecal contamination. Fecal contamination is a problem. But more than that, along with the wastewater, lot of nutrients and pharmaceuticals and personal care products are getting discharged. You know that when we consume any medicine, only 20 to 40% is getting absorbed in our body. Remaining is getting discharged through urine and feces. So all these things will be present in the wastewater, and the wastewater will be having lot of microorganisms. When these microorganisms get exposed to these pharmaceutically active compounds, they generate antibiotic resistance. And antibiotic resistance genes are present in these microorganisms. And when we discharge this wastewater to the water bodies, these microorganisms will be entering in the water bodies. And when we consume that water, if these pathogens enter in our body, these pathogens are antibiotic resistant. So if you get any disease, many a times existing antibiotics may not be effective. So this is another important point we have to remember when we discharge the wastewater without treatment to the water bodies. Not only fecal coliforms, antibiotic resistant genes will be there. So antibiotics will not be effective. So even a small fever can be fatal in the future because of this incident. So, and if you look into the world, you can see that these nutrients and pharmaceutically active compounds are detected in many, many places. Before going to this one, we have from IIT Madras along with UNICEF, we have also conducted water quality testing in Kerala. We have selected 4 districts: Alappuzha, Kottayam, Calicut and Wayanad. We have collected water samples from around 140 wells, with different depths, and we could see that almost all the wells are having the fecal coliforms because, you have the building norms. The toilet should be this much meter, 10 meter away from the well, but there is no restriction from the next house. And in Kerala, for 1 kilometer squared, around 250 toilets and around 250 wells are there. So each one will be feeding to the other, because the toilets, the septic tank effluent will be getting into the groundwater, and we pump the water. It will be coming into the well water, and many times it is not getting treated also. So when we talk about the sustainable wastewater management, it's always better to see wastewater as a resource, because many times we see that wastewater is a problem, but once we think that wastewater is a resource, all our problems can be addressed because it is having lot of nutrients. You have water and you have energy. We can recover from the wastewater. So when we talk about the current wastewater treatment practice, the cities are generating wastewater and we are collecting, and some amount of treatment, very little is happening, and everything is disposed into the water bodies and they are getting contaminated. And many places the treatment compliance itself is not there. So what we have to do, we have to go for reuse and recovery. That means circular economy concept. That is the need of the hour. I just give one example. We can achieve circularity with respect to water, nutrient, carbon and energy through wastewater, sludge and organic waste treatment. You can see that this is your wastewater. We can recover nutrients and energy, water, and we can use conventional treatment, engineered natural treatment systems. Don't think that always we have to go for okay, mechanized treatment systems. There are many engineered natural systems available, very sustainable treatment technologies. Then solid separation, okay, we can get lot of energy, and nowadays we can make the wastewater treatment plant as energy positive also. So I will just talk about what we have done in IIT Madras, because any small community this is possible, because IIT Madras we have a population of around 1,800 and projected population is around 2,000, and you know that Chennai has lot of water problems. So we were closing our semesters before time, and many times classes were starting later and all the things. So, okay, what we thought is, how can we solve this problem? Then we realized that if we can use wastewater as a reliable source of water, that will be solving the problem of contamination and we'll be getting the water. So, it is nothing rocket science or anything. We have put up a plant around 4 million liters per day. Okay, the membrane bioreactor, SBR technology, sequential batch reactor technology with nutrient removal. Then, okay, what we have done is, okay, we have put up a ultrafiltration unit and an ozonator. So, this water, okay, we are getting very good quality water after this treatment, and the sludge, okay, we are centrifuging and okay, trying it and using as a manure in the campus. Okay, and okay, this water we have put dual pipeline system in the entire campus, and 100% water recycling is happening in our campus. And some water we are using for the biota or ecological reasons. So we get lot of birds and all the things, and still all the flushing, air conditioning, horticulture, everything. After that one also around 30 to 40% of water will be left over. What we are doing is, we are putting a filter, filtering it, and we have an infiltration gallery made up and sending the water to the lake. We have a lake in the campus. We have, it is a man-made type of a lake. We have made the lake, expanded the area, and we are collecting all the rainwater here and the treated wastewater, which is of drinking water quality, and we are putting here, because if you directly supply, people will not be accepting it. So we are putting it in the lake. Then there we have a water treatment plant. We are taking the water from the lake, treating it, and blending with the city water and supplying to the campus. So this is the way we have achieved zero liquid discharge in the campus, or 100% water recycling. And we could save yearly around 2.5 crores on water bill itself, okay, for the campus. Not only that one, okay, we didn't have any water scarcity problem, etc. So after seeing how we are managing the water, okay, the Chennai Metro Water and Sewerage Board planning CMWSSB wanted to do this one, because they were also having lot of problem. So we are helping them to do this one. And okay, they wanted to initially put up some 2 10 MLD plants with complete recycling. So okay, when we put up a plant, we have to see that it is safe, because they wanted to supply the water to the public. So at any time there should not be any problem. So we have given the technology. You can see that after the, I'm sorry about it. After the primary treatment, it is going to a SBR, and after the SBR, it is going to ultrafiltration sand filter, then ultrafiltration unit, then a multigrade filter, then before the multigrade filter, we are doing the chlorination, okay, then UF treated water is passing through activated carbon filter, then ozonation, then they are pumping to the lake, which is used for the water supply in the city. So with all these treatment technologies, we are taking care of all type of pollutants, including emerging contaminants like pharmaceuticals and personal care products. This is the plant they have put up, and it is in operation for last 8 months. 10 MLD plant, and all the water is supplied to Porur Lake, and there they are taking and supplying us drinking water. And you can see that the analysis report, okay, it is okay as good as or better than that tap water at any time we get it. So, and another plant is already completed. Okay, the second plant, the Perigudi STP to Perigudi Lake, another 10 million liters per day. So by doing this one, we are not only treating the wastewater, okay, we are removing all the residual pollution, and when you put it into the water body, the groundwater recharge is happening. So we are not allowing the water to go away. So now Chennai is planning to expand this onto all the lakes in the city. So they are planning to put around 260 million liters per day treatment plant with this facility, and we have identified all the lakes where we can supply this treated water, because it is not a big plant, many decentralized water plants, so that okay, we can recycle completely and protect the water bodies. Okay, so benefits, you know that Chennai water scarcity problem can be okay solved using this one, that is a plan. So the DPR is ready for the 260 MLD plant, and we were helping them all throughout. So now I'll talk about what we have done, the sustainable water and waste management in villages. We know that government has taken many initiatives like Swachh Bharat Abhiyan, Jal Jeevan Mission. They are supplying, every rural household will be getting drinking water, but many times all these programs will be giving the fund for asset creation. There will not be any operation and maintenance cost available, okay, and many places still the same condition is prevailing because sustainability of the water source. So, and the toilets, many times it is not being used because of lack of water availability and all. And any water sources we see, because of the waste disposal and solid waste, mismanagement of solid waste, all the water bodies are getting contaminated, and the same case is here in Kerala also. So if you want to improve the hygiene and sanitation, you have to have toilets, and site-specific technology is needed, okay, to prevent the groundwater contamination. Because earlier panel discussion, somebody was telling that septic tank is not the right thing for Kerala. Yes, I agree with that one, because our groundwater table is so high, and septic tank will be removing only 50% of your pollution, and lot of fecal coliform will be coming out of septic tank, and water table is so high, so your groundwater will be completely getting contaminated. So we have to have some type of decentralized wastewater treatment systems in this state. So what we have done, okay, some 5 panchayats we were working using the CSR funds. So when we wanted to have hygiene and sanitation, wastewater alone or water supply alone will not be helping. Integrated solid waste and liquid waste management is needed. So first we started with municipal solid waste management through and resource recovery, then local manpower training, and okay, rainwater harvesting. So initially we have done lot of training, awareness creation. Without that one we will not be able to get into any villages. And this is what we have done, okay. When we collect all the mixed waste and started segregating it and going to treat, it will create lot of problem. But if we can segregate it in the source and have your decentralized management systems, much of the problem behind my backyard problem can be solved. So that's what we could see in many panchayats. So what we have done is, all the organic waste, we have given them 3 bins. We asked them to separate it into 3 categories. One is organic waste, and inorganic recycling waste, and sanitary waste. Because sanitary waste is generated in almost all the households. When it is mixed with the inorganic waste, again the inorganic waste become non-usable. So we were asking them to segregate into 3 categories. and organic waste was going for composting. Inorganic waste, segregated it and sell. Then sanitary waste, all these panchayats or villages, we have put a small incinerator so that the sanitary waste can be managed. And stormwater, we put stormwater trains, recharge to water bodies or the ground. And wastewater, we put small bore system, collected the wastewater and treated with engineered natural systems. So before starting, what we did is, complete cleaning of the village or panchayat, because if the panchayat is clean, nobody will have a tendency to throw any waste. So first thing we have done is cleaning the villages or panchayat, then rejuvenating the water bodies. You can see that. Then we have gone and given this one sand all. And the wastewater management in the village, what we have done, you can see that the rainwater, this is the drainage pipe, the rainwater train, and in that one we put a small bore system, to collect the septic tank effluent and the grey water coming from each and every house. It is a small pipe, 10 centimeter diameter pipe. You can put it in the drainage thing, and you can see that each household you will be having a settling tank, and any suspended solids are there, it will be settling here, and the supernatant will be entering into the pipe. You can see, it will be from the kitchen, septic tank effluent, bathroom, all the waste we are collecting through that one. Then what we have done is, this is the constructed wetland we have created. Here we put a cement tank and all, because this was a waterlogging area. Otherwise you don't have to construct this cement tank or anything. You can just make a trench and put some clay lining or something like that. That is enough. So we have constructed the constructed wetland, and this is our solid waste management system in each village, 2 or 3 each panchayat. So there are no problem, because small their own waste they are segregating, so people are not creating any problem. So this is the compost. This is inorganic waste is segregated into 11 different categories, and incinerator for sanitary waste. And the compost they are selling, they are getting around 35 to 40% of the total expenditure through the compost selling and the inorganic waste selling. And we have carried out, once we did 2 villages, then it is expanded to the entire village. Same thing we have done. Before entering, this was the type of the village, and after that one you can see that everything is cleared. We were giving all these things, and if you have the load coming to the constructed wetland is more, what you can do is you can put a modified septic tank. Modified septic tank means it is like a anaerobic baffle wall reactor with supporting media, so that will be taking care of around 60 to 70% of your organic load. Then you can go to the constructed wetland. Don't worry about the area. Area will be very area requirement is almost equivalent to a septic tank, and you will be getting very clean treated water. You see, this is the constructed wetland outlet. It is meeting all the standards, and we are using this water for agriculture purpose. No mechanical thing. You don't have to provide any energy, nothing, and the land requirement is less. And here we have put canna, but you can plant other things, fodder gas or something like that, which can be used, and people will be cutting and taking. So in that way, self-maintenance also will be happening. And revenue generation, I told you, almost 30 to 40% of the cost will be generated by selling the things. And by seeing that one, CPCL has given us around 15 crore amount to do it in some 5 panchayats. We have done in 5 panchayats. It was a complete overall development of the village, water supply, drinking water distribution, regeneration and rehabilitation of water bodies, solid waste management, wastewater management, awareness, health, pedagogy, everything. So again, awareness is very important. Then we have created household toilet. When we went and discussed with the people, they told that toilet alone will not be helping. We we want a bathroom come toilet. So we have constructed bathroom come toilet because many other toilets existing were not functioning properly. So we have done that one. And they had around 21 big village ponds. Everything is regenerated, and we put lot of infiltration wells there so that the groundwater level will be increasing. And these ponds are used for, water is used for agriculture purpose. And drinking water, it's a coastal area. So we have gone for deep borewell around 900 feet, 700 to 900 feet. Deep borewell we have installed after doing all the hydrogeological study, and water supply system is provided in the village. And we have done all the school and Angamwadi regeneration, solid waste management, pedagogy, solar street light, skill development. All these things we have done. And yes, we got lot of things in return. What I am trying to tell is, when you do the sustainable water or waste management, means the outcome is very visible and the people are very, very happy. And we also develop many other new technologies. This is grey water treatment system. Whether we can recycle our grey water from our own bathroom for bathing purpose or flushing purpose there itself instead of taking anywhere. So this is the technology we have used: grey water, coagulation, and ultrafiltration and adsorption. So directly you can use it for bathing purpose without any problem, because all the pollutants will be getting removed. So this is the pilot scale, and we have installed in some houses also, and everything is monitoring so that there will not be any risk. Anytime any quality is deviating, we will be getting the alarm, so we can go and check it whether it is working properly or not. So this is the treated water tank. So in the toilet, above the toilet, you will be always having the space. There you can put the treatment system and collect it. Yeah. So you can see that. You don't have to have any mechanized system. Everything will be getting mixed and it will be settling. You will be getting very good quality water. And we also looked into adding a biological system so that the dissolved organic content can be reduced very significantly. That is also, you see, what is the after ultrafiltration, your pH, turbidity, TSS, COD, TOC, everything is coming down, and within the permissible limit, there is no point. And similarly, we have developed the apparatus for washing machine, whether the wash water can be recycled within the washing machine. So same thing, within that 40 minutes time, that 12 minutes time, we can treat entire water and put it back to the washing machine for the next cycle. So that's what we did it. And the treated water is the same as the tap water. And this is another thing we have done: zero liquid discharge toilet. So instead of mixing, because one of the colleagues were telling that why are we mixing it and diluting it? If you separate the urine and the feces and urine, you distill it using solar energy, and solid you try it, you will be getting very rich manure. And so you can have a self-sustained toilet without any water input, energy input. So that's what we have developed. So you can see that quality of the treated water, very clean water you will be getting, and whatever the residue you coming, mix with the solid and try it, and we have put it up in our campus. So this is the solid you are getting, very rich in the nutrient content. And this is another thing we have developed, toilet for schools. My colleague Varun also was involved in that one. So what we are doing is, many places school toilets are not working or people are not using because of lack of water. So whether we can develop a toilet for the schools or offices where we can recycle the water within the toilet itself and make sure that there is no risk involved. So here what we have done is, we have developed a system, a modified septic tank and a attached aerobic system, and this attached aerobic system is working only in with solar power, and the aeration will be happening only during daytime 9 to 4, when there is no battery, nothing. And during night time, okay, some part of the wastewater will be sent to the aerobic system. So you will be removing all the nitrogen, denitrification will be happening, then followed by a filtration and chlorination. Then we have all the sensors to check the quality. If the quality is meeting the standard, it will be pumped to the overhead tank, which can be used for the flushing purpose. In any time the quality is not meeting, we can put it to the soak pit. So that's the way we have done. And all the sensors are in-house developed sensors. So this is a system, and if you see that land requirement, it is only the space required for a septic tank. You can make your modified septic tank and submerged tank and filter feed underground and other things above ground. And we have put up in 2 schools in Chennai. Okay, one is in KV school and another one is Vimala Convent School. Both are having around 1,000 students studying there. So this is the system. Okay, solar panels and all. And you can see that the performance, okay, everything is meeting the standards at any time. So in summary, waste a resource, not a problem. Practice, reduce, recycle and reuse. Resources are limited. Protect the natural resources and reuse the wastewater. This will significantly reduce the freshwater reuse. Proper operation and maintenance is needed. Wholesome approach to waste management is essential. Okay, and all these things are done, okay, because of my students and the project staff. Okay, without them nothing can be done. So thank you very much. Any questions? Any follow-up?
Thank you so much, ma'am, for this discussion on the sustainable structures for liquid waste management. Any questions from the audience?
Sí. Sí.
Yeah.
Testing. First of all, I appreciate the energy level of presentation. And this question, simple question it is. Did you ever try, madam, aquifer recharging of the flood water? Sometimes we get a lot of water in the rain time. So we can charge some aquifers, empty aquifers with this water. Did you ever try like these things?
See, okay, we have not tried deep aquifers, but the shallow aquifers, okay, in Tamil Nadu, lot of this thing is going on. What we are doing is, we make a small ditch, maybe 3-meter deep ditch, and put gravel and sand in that one, and the water will be going there and it will be percolating. That is one way we are doing. Another one is, all these ponds, we put recharge wells. That wells will be deeper and it will be, okay, when the flood comes, all the water will be getting through that one and it will be getting into the ground. Okay, both the ways, in water bodies, put the recharge wells, or other places you put the pits and through that one water recharge.
Yeah, that is post-draft, post-draft recharging.
Yeah. Okay, otherwise, any abandoned open well is there, divert all the water to that one and it will be getting recharged.
You can do the flood management and do it like this.
Yeah.
You have to find out which are the empty aquifers nearby.
Yeah.
Madam, you have said that in waterlogged areas, septic tank is not suitable.
Yeah.
Then which one is?
See, septic tank you can use as a solid liquid separation system, because septic tank will be holding all the solids and some degradation will be happening and the volume will be reducing. Whatever the liquid coming out, it will be having lot of organic matter and fecal coliform. So put the septic tank and whatever the effluent coming, you can use this type of a small bore system. It is a very economical thing. Okay, you put a pipe and it is a pressure flow. Okay, so you don't have to have larger diameter or anything. Collect it through that one, and for a street or a small area, and take it to a nearby area and go for this constructed wetland or something like that. It will be subsurface flow, so it will never create any odor problem or anything, and people will not be telling about the nuisance. Okay, so that is the way, so that it will not be contaminating the groundwater.
What about the individual households? They may not
Individual households also, what we can do is, that's what we have done in Nagapattinam. The septic tank effluent, you take it and put a reed bed. Okay, small reed bed, and pass it through that one, so that okay, the plants, bacteria and the matrix, whatever you are putting, everything will be treating that one, so that there will not be any problem.
Oh.
Yeah.
Any other questions? Okay, thank you so much, ma'am, for the session. I would like to invite Praveen sir for felicitating ma'am for her time and a very interesting session. All right. Last but not the least, we have another session by another distinguished speaker from IIT Bombay. I would now like to invite Professor Pradeep for a session on low-cost resilient infrastructure for liquid waste management. Share me. It's not coming on the screen.
Okay. Good evening all. So I'll be talking more about connecting the technology with the ground challenges, and whatever discussions that have happened in the panel and whatever nicely Professor Liji has given the technologies overview. I'll be more talking about what is relevant for different contexts and how we can combine the technologies, how we can use the different policy approaches for enabling the technologies on the ground, liquid waste management technologies. And from resilience perspective, so we all have been working on sustainability development goals, and resilience is one of the new challenge due to climate change that is emerging. So water management infrastructure is, and my focus is mostly on urban, dense urban or peri-urban or emerging towns and cities. Water infrastructure has hard infrastructure, which is, you see civil tanks, mechanical tanks, all that, electromechanical components, that is hard infrastructure. But we keep forgetting about the soft infrastructure, that is social infrastructure. And there are a lot of stakeholders that are involved, such as planners, consultants, research organizations, NGOs, regulators, and many other people. So we have to culminate both of the hard infrastructure and soft infrastructure to get the desired result of resilient and sustainable infrastructure. Sustainability can be measured or quantified using these 5 parameters. The technology that we are choosing has to be environmentally relevant, economically affordable, socially acceptable, governance should be easy, and it should be technically robust. So we have a huge challenge to identify such technology metrics, technology chain for different contexts. So these 5 metrics I'm giving you to assess a solution proposed by anyone when you evaluate the technologies. So sustainability is, everybody knows what is sustainability, so I will not define it, but now resilience is coming as a new expectation in the infrastructure domain. And concept of resilience emerged from ecology, that something that is, if you see our natural ecosystem, if something happens to ecosystem, it tries to revive back. The same principle is used here for water resilience, capacity of cities to function in the face of water crisis. How we can revive the functions of water infrastructure in the case of catastrophe. And catastrophe can be induced by floods, by droughts, by, let's say, festivals. Anywhere you have a large demand or very less demand, how our infrastructure function is also need to be understood. So we need to see what happens when catastrophe struck to the infrastructure, the performance goes very down, and how we can bring it up in a minimalistic time. So our government departments, utilities, companies who operate the infrastructure have to now prepare for catastrophic situations, because if you see last year in Mumbai we had a huge problem when entire water treatment plant was flooded with flood water, and entire 3000 MLD water was at stake because only one location, one plant was available. So our the matrix for resilience is the technology should be adaptable, because our future is unknown. So technology should be adaptable, technology should be flexible, and technology should be robust. So these 5 sustainability and 3 resilience criteria I am telling to judge what is sustainable and resilient infrastructure. And we have to bring these 2 perspectives together of sustainability and resilience to decide what is more prudent for our liquid waste management. And then only we'll be able to talk about what is rational development for different cities and areas. So we need both the perspectives for liquid waste management, sustainability and resilience. If you will not work on any of these aspects, then we'll have infrastructure, but it will not be suitable for the given condition, and most of the infrastructure will go waste. A lot of been talked about what is the situation of liquid waste management in India. We have a lot of sewage generation, but infrastructure is not matching. And day by day we are learning water is important resource, but wastewater is more important resource. And there are different challenges in managing this infrastructure, from water intakes to the distribution to the collection. Sewerage networks are not there, sewage treatment plants are not there, and whether we should really have sewerage network for some regions like Kerala, whether you should go for sewerage network or not is a big question, and we'll discuss something about that. And the new expectation from National Green Tribunal is about all these BOD or other parameters should be brought down to 10 milligram per liters. And we may see as a huge challenge, but it can be turned it out as an opportunity also. For example, some examples Professor Liji has given, how to recycle at different scales and different levels. There are different approaches for wastewater management. For example, we can do prevention and conservation. Lot many times prevention and conservation is forgotten, and we directly jump to treatment. And then comes recycling, and then comes recovery. And treatment and recovery can happen at household level, decentralized level, or centralized systems. But prevention and conservation doesn't get focused in most of the cities, because if you reduce the water consumption by, then wastewater generated is also less. And there are a number of technologies, and I will not focus, I'll just give this chart. There is no dearth of technologies. What is missing is how we are planning our infrastructure. So whether you use physicochemical process, whether you use biological process, whether we use aerobic or anaerobic, that more important that how you plan your infrastructure. So what is wrong in current approach? Any city that we are planning nowadays has the fixed system boundary, that water is fetched from water reservoirs for the agriculture as well as for cities, And we are using artificial fertilizers where we are fixing the nitrogen and creating the fertilizers using huge amount of energy. And we are also using chemicals, household cleaners, and that is also creating huge stress on our sewage systems. And that we are trying to do the Western model, the developed country model. We are trying to adopt centralized underground drainage network system, which is not relevant for many cities in Indian context. And most of the time, these large sewage treatment plants do not function well. They partially treat the wastewater, and our freshwater bodies, underground water gets contaminated. And a lot of energy also we use for taking out the BOD and the nutrients. So we are using energy on one side to fix the nitrogen, and we are using energy again to take out the nitrogen from the wastewater. So basically we have created a system which is not much wise at a broader scale. So we have to stop using these artificial fertilizers, create the fertilizer chain from the different sludge that we get, and we have to stop disposing of the untreated sewage, and you can create the local water reuse and create our own water in the cities. We have to stop consuming energy for the sewage treatment. We can also generate energy from the sewage treatment, and that most of the things is possible using decentralization, and I'll talk something about decentralization here more. And by meaning decentralization, that doesn't mean only using natural treatment system. We can do decentralization by using mechanized treatment system, high-tech treatment systems also. So you have centralized treatment systems like this. If you stuck with this kind of system where everything is taken out of the city and creating the infrastructure at the tail end of the city, there is no opportunity of recycling sewage or sludge, and we end up getting only disposal of the resources and not recycling of the resources. So we have to plan the infrastructure for cities in a manner where we can locally reuse the wastewater, and we can also create some opportunities for sludge recycling. Because if you see the amount of sludge that is also going to produce from the sewage treatment plant, it has to be transported somewhere else. So we have to plan these sewage treatment plant locations more wisely. So what I argue is more important is the scale than the technology itself. So we have to plan our technology scales very maturely than the technologies itself. So two small systems will be very difficult to operate and govern, because if you plan very small STPs, government and the departments will not have that kind of institutions and governance mechanisms to control, monitor, regulate these kind of treatment plants. Current scenario is most of the people are politicians, consultants, are comfortable to go for a single DPR for a city and plan everything at a large scale. But that is the comfort zone, because you can announce big projects. But if you see the utility of this infrastructure is very low, because in initial years there is no sewage flow and the sewage treatment plant capacity is not completely utilized. So highly centralized systems place challenges in recycling treated effluent and sludge, and there is no scale of economy beyond one point. So if somebody is saying that because bigger systems gives cost economics, is not good beyond one certain point. And it additionally requires deeper sewage network, and in many cities I have seen maintaining deeper sewer network is not a good idea. So I think if Kerala do not have underground drainage system, we should not go for a very large, deep and centralized systems for states like Kerala. So not very highly decentralized, not very highly centralized. Our comfort zone for sustainability and resilience is somewhere in between. So we have to plan the infrastructure. So if we are planning the city's infrastructure, break it down in the phases, break it down in the clusters, and then implement. So idea is whether you plan whenever you plan a decentralized system, with whatever technology based on the land availability, you can go for mechanized or you can go for natural. Choice is yours, depending on the funds, depending on the land availability, and I'll show you some analysis about land availability also. What is more important is going for a decentralization, because that will create lot of opportunities for recycling and use of effluent and sludge recycling. One of the case we studied with the DST funded project was case of Ludhiana, where we studied the centralized network design with the decentralized network design. City already had a centralized network. We converted that into decentralized zones, and we studied, surveyed the entire area, converted to decentralized. So we used QGIS, mapped the entire zones, recreated the networks to compare the cost. Most of the times people say that decentralized systems are costly, but this analysis showed that decentralized systems has almost same cost if you plan in that fashion. So one notion of having decentralized systems more costly is not correct. Centralized and decentralized systems are almost having same cost. So the recommendation is go for decentralized system, and whether depending on the local situation you decide whether you use mechanized system or natural treatment system. The next is we have to move to the circularity, and circular economy of water is very important. So right now what we are doing is using the freshwater resources, dumping in the freshwater body. But you can use reduce, reuse, recycle, reclaim, recover and restore. 6 R's framework we have developed, which can be used for implementing circular economy. And water get exchanged between water treatment plant, urban area, wastewater treatment plant, industries, agriculture land, natural environment and many places. What we have proposed is to how we can do the this particular reduce, reuse, all the 6 R's, and detailed framework we have written for implementing in a different context in different areas. The major challenges in wastewater recycling is the scale of implementation is not known for the cities. Everybody is running for highly centralized system. That is not correct. You have to rework the scale of implementation. Energy requirement, can we make it energy neutral or less energy intensive? Other resources such as nitrogen, phosphorus, can we create closed loops? Pathogens reliability, Professor Leji has talked about pathogen reliability. Emerging contaminants. One problem of fecal sludge is quantity, but the chemicals that people use in septic for cleaning the toilets is also causing damage to septic tanks. If awareness is created to use organic cleaners, septic tanks will not fail and fecal sludge volume generated will be little, and that is a neglected area in my opinion. Revenue models, operation and maintenance challenges, urban local body capacities and conservation, working with the consumers. This is all needed. So you have the choice of going for mechanized treatments or natural treatment systems. And I will not talk about what are the options available. I'll just talk about the trade-off, because natural treatment systems can be using phytoremediation, bioremediation, zoo or hybrid systems. And there are a number of benefits, but still it is not yet adopted as a primary solution for achieving sustainability resilience. One reason cited is of odor, land not available, but there are many good projects coming up. This is from Delhi, where natural treatment system is used to create a playground. The students are playing on a nearby natural treatment system. This is from Dharmashala, where natural treatment systems are largely used for creating recycled wastewater. So what the challenge is, our old STPs need to be retrofitted and new STPs need a lot of investment. So we need to devise a method of optimal capital cost and minimum operation and maintenance cost. And different technologies are available: SBR, ASB, MBR, USV, and your objective can be disposal or recycling. So energy consumption, capex, opex, reliability and land requirement needs to be considered. And when you plot the cost, and this is the important graph, the brown is the mechanized treatment systems. The cost of mechanized treatment systems is exponentially increased if you go for recycling, whereas the natural treatment systems, which are in a green, do not have that much cost. But if you look at the land requirement, it has different scenario. Natural treatment systems requires huge land and mechanized treatment system requires lesser land. So what I'm proposing is to shift from mechanized treatment system to natural treatment system at the level of 30 to 40 milligram per liter. So have a very good so for cities, have a good primary plus coarse aeration system, get as much possible BOD removed with the mechanized treatment with less land, and then apply natural treatment systems. So I have proposed and written this particular policy paper about combining how we can combine best mechanized treatment system with natural treatment system, so that one of the point in the panel discussion was reducing the operation and maintenance cost. We can reduce the operation and maintenance cost using this kind of model, and these kind of models are now used in Himachal Pradesh, where combination of good mechanized treatment system with natural treatment system, and this is one of example of hybrid treatment system, where you can see anaerobic baffle reactor followed by constructed wetland followed by pond is shown here. One of the point is life cycle cost. We have to consider the life cycle cost, and if you consider even the land cost, and I considered in this analysis rupees 1.6 crore per acre, 1.6 crore per acre in cities, and if you consider the electricity bill to be provided for mechanized treatment system, it is wise for municipality or Gram Panchayat to buy the land and create the treatment system than investing in a machinery, because machinery will need a lot of billing. So here it shows whether you are in urban, peri-urban or rural area, if you use the 30 years life cycle cost analysis, this shows that it is wise to go for constructed wetland, natural treatment systems or hybrid treatment systems than active dislodge process or MBR whenever you can purchase the land, because you can. So I have also written to many of the policy making bodies that allow municipalities to buy the land for sewage treatment and make natural treatment system happen, because natural treatment system will have good resilience, it can be implemented in a decentralized way, and it has a huge amount of significant benefits because we need to upgrade the STPs also. So there are economic environmental benefits of adopting natural and hybrid treatment system is, if you adopt it at a very large scale, you can save the energy also, 200 gigawatt energy for existing STPs, 350 gigawatts for emerging STPs that will come, and also climate change mitigation. And there is a scope for scalability, because we have 415 cities that are coming up. So we can use this model of hybrid treatment systems, and you can use the HTS approach for enhance the regional job creation, and then use the revenue generation model, and there is an opportunity to create a circular economy for bio-based material generation and many of these. Such of the model with Ramanji sitting here, I was with him in the Chittoor Tatmangalam in Kerala, where we have proposed this kind of model for planning the decentralized cluster-based situation, sanitation system. So currently the issue faced in Chittoor is the irrigation canals are converted to drains. You can see these are irrigation canals actually, which are the drains now. And these are the ponds, natural ponds, which are converted into now completely not usable and has a lot of weeds. So there is a huge suitability for decentralized for places like Chittoor, and we use this particular one pond as a pilot to convert from take the entire sewerage and use natural treatment, hybrid treatment system, and convert this dumped pond into rejuvenated site. And this is the current status of these ponds and the drains, and we have given the proposal, and this has a very good alignment with the development goals, which is beneficial from both sustainability and resilience. So finally what I'm saying is, we have to plan the cities holistically. Don't rush for sewerage systems everywhere, underground network systems or network systems. The core area can be underground network, only the core area, okay? That DPR can be separate. Then you have a separate DPR, maybe small bore system, as Professor Liji has said, or open drain network, which is followed after a septic tank, followed by some treatment, and then open drain network for peripheral systems. And then you can have a neighborhood network also, which can be on-site systems. What is happening in cities is everyone is planning for all the DPR underground drainage network everywhere, which will not be wise, both cost-wise, sustainability-wise, or resilience-wise. So this is the framework that we have just proposed, and it is available, published now. So finally, recommendation is go for decentralization, first possible with natural treatment systems, then hybrid treatment systems. If not at all possible to purchase the land, then go for mechanized treatment systems, and then achieve the sustainability and resilience. And we have to focus on emerging contaminants, nutrient recycling. So approach to follow, maybe use constructed wetlands, which is more suitable for Indian conditions. And we can use these technologies from rural, peri-urban to urban areas. So with this, I stop my presentation. This is my recommendation. I acknowledge the DST funding. Based on this, the research was conducted. And you can contact if you want to create such cases. Thank you.
Thank you so much, sir, for this very insightful presentation on the low-cost resilient structures. Any questions from the audience?
Good evening, sir. I'm Solomon Thomas. I'm a designer also. So I think one of the major problems we are facing have not addressed. For example, in Kerala or anywhere else of the flat hospitals having more dilution, having the water, wastewater having more dilution, the input BOD is almost 60 to 150. I never see the input BOD 300 or 500. We are not getting a settling property unless the MLVS is 2000 or 4000, between 2000 and 4000. So while the less BOD, it is very easy to convert a 900 BOD to 50. Because the MLVSs, we have sufficient quantity of MLVSs. But the BOD 100 to 50, to bring from 100 to 10, it is a Herculean task I have faced. For that, if you have any remedy, any solution for that, kindly tell me. 90% of the residential flat, hospitals, everywhere in Kerala or anywhere else of India, if you go, if you test the input water and if you test the output water, the water is more or less almost same. Even though the plant is working more than 10 or 16 hours. Then what else is the use for spending 20 lakhs rupees or 50 lakhs rupees for a treatment plant? Yesterday also I just went to site. That plant was working around 6-7 years back, but it was working. If it's not working, okay. But even though I have tested the raw water and the output water, the BOD is almost same. The raw water is around 100 BOD and the output water is around 60 BOD. So kindly give me, because sequence-based reactor is the solution, but
for such,
are there any solution, please tell me.
For such small properties, you can go for anaerobic filter and constructed wetland. If the flows are small, and if you have such a commercial space, complete commercial area, then you can go for a cluster sewage treatment plant. But that is not full-fledged STP. As you said, if BOD is 50-60, you can just use a rock filter or a simple filter just to take the solids load, just suspended solids load, and then you go for a constructed wetland, just pass it through the bed, and then see the performance. All the natural treatment systems will behave differently at different locations. So you have to try and see what works, and you can go for mechanized if there is a value for recycling. In Kerala, I tell you, water is available in excess. So recycling, nobody will be interested in recycling for higher end purposes.
Sir, I think it is, you have not got the point. Because see, where we are constructing STP, there is no place, there is no wetland, there is no free land. There is 3 types of disposal sites are there. Natural water, that sewage water, and there is no any other. So there the pollution control board is insisting to bring down to 10 BOD. But unfortunately, this 100 BOD is not coming to 10 or 20, it is 30 only. So investing money for air blowers, space settlers, it is not settling at all.
Yeah, it will not settle. It is not. It doesn't have that much
is not
BOD.
a question there. There is no place at all.
So if you see, first of all, you don't have to bring it to that legal battle we have to make. That why you have to bring it 10 when you are disposing into the public sewer. So I also don't agree with this NGT order which is saying 10 milligram per liter everywhere. It is not required. First of all, But if you are forced by government department, then there is no pressure sand filter, activated carbon filter, and maybe disinfection. There is no other way you can do it.
No, sir. I got a very good experience. If you submit the water, unless the BOD is less than 20 or 10, the sand filter or n numbers of filter, if you fit within 1 month, it will get charged. There is no point in.
So you need to do good primary. You need to do a good primary treatment. Now you cannot subject to directly to pressure sand filter. So good primary treatment. So maybe disc filter you can apply before. You can bring disc filter. So some good primary treatment you have to bring.
Sir, have you come across any sewage plant of flat or hospital? The aeration tank, water, the color is brown color.
It will not happen. It will not. It will not come. It will not happen.
Seen it's black color. That means it is not working.
See, first of all, for 50 milligram, you cannot go for full-fledged biological system. That is very clear. So you have to depend on mechanized system. So UF member you have to go for, which will be costly. That's what is the final solution will come.
Mechanized system only, I'm telling you, sir.
That's the legislation issue. That's the legislation issue. That why then NGT? So file PIL in NGT. So as a body, as a practitioners, file a PIL in NGT. Why 10 milligram per liter? Technologically, it's only UF and disinfection then.
Sir, even UF also, if you give more than 20 or 30 BOD, it will get charged.
No, after good primary, there is a chain of system you have to maintain. You cannot subject everything to directly UF or also ACF. There is a good primary treatment needed.
Even after primary, what do you mean?
It is costly. There is no other alternative.
What do you mean by the primary treatments? What do you adopt for the primary treatments?
So,
bar screen chamber and taking to the settling, primary settling.
No, there is
no particles for settling.
There can be disc filters. There are filters available before this also. But you don't subject directly to UF or any other without good primary treatment.
Nobody will. Okay. It's not answer.
Okay. Any other question?
I am Sajay Kumar. I am coming from southern part of Kerala, Trivandrum. So, my simple, not a question, the reality. So, you just talked about that decentralized system and shown the Tattamangalam, that model. Okay. Anyhow, a lot of places in Kerala, Trivandrum and Ernakulam is close the 10 lakhs population. So, on the strength of that population, Government of India has sanctioned the centralized STP plant. So, Ernakulam STP plant, that area I don't have any idea. But in Trivandrum, it is very close to coastal area. I think maybe maximum, within the 1 kilometer. So my question is, the Tattamangalam model is in my mind, whatever you described about that. But actually, from where the sewage treatment plant that input is coming? After it's of water. And from where that urban population is getting the water resource. So it is coming from the faraway places of suppose in Trivandrum, about 20-25 km away from Arivikaram, Pepar Dam, in that area. So it is all coming through that suburban or village area and deprive the what is their rightful portion of the water to the villages. And it is coming to the urban area. And we are that misusing and a huge amount is spending on part of that centralized sewage treatment plant. This already pointed out that. But why that? My request is, so I remember about 2002, I think so. And in that area, suburban that area, huge that draft system is coming, and Nayar Dam and that places, and people maybe no. And there that paddy field and everything is out of that, and badly they are affected.
and they are not getting irrigation water channel and their channels and everything there. You talked about the Tamil Nadu area, but they are not getting the enough water, the rightful things of water to, and deprive. I am using the way deprive their rightful portion, and we are wasting. The selection of that plant itself near the coast is to dump the or simply run off the water to the sea, not to getting back to the villages. Why can't we use that network or that canal system and bring back to the agriculture purpose the villages? That plan is, and this authority, and they might take care of these things. Even in Ernakulam, if they starting this thing, STP plant is thing, the same thing is happening here also. So that must be, at least the plant should have been in other area. It is in western side of Trivandrum, but it should have been in eastern or other northern part of the Trivandrum. Otherwise, a little, that much more useful thing is there. And another one thing is about our previous gentleman is saying, actually real things is what is described about the reality of the STP plants in flash or everything. But what is my experience, it is pure operation and maintenance cost, means procedures, and that's all. That is not a problem with the technology. So thank you.
Thank you.
Okay. So since we are running short of time, so we'll, if there are any more questions, you can write back to us. The QR code is just behind you. You can fill the form. In the remarks session, you can write your comments or questions and we'll get back to you. Okay, thank you so much, sir, for your time and for this insightful discussion on the low-cost resilient models. I would now request Praveen, sir, to provide a memento. Can we have a huge round of applause? Yeah, thank you. Okay, that comes to an end for today's session. Thank you all for your time. We'll meet again tomorrow with some interesting sessions. Thank you all.